PCSK9 inhibitors and cholesterol. PCSK9 inhibition. A game changer in cholesterol management. This is the next big breakthrough in the treatment of high cholesterol. To understand how this new medication class works, you have to first understand the PCSK9 gene. Stay tuned to learn about how this gene affects blood cholesterol, and how researchers are using that information to create new treatments for an all-too-common problem. The PCSK9 gene. We all have a gene called proprotein convertase subtilisin, casein type 9, PCSK9. This gene directly affects the number of low-density lipoprotein, LDL, receptors in the body. Meanwhile, LDL receptors help regulate the amount of LDL cholesterol that enters the bloodstream. Most LDL receptors appear on the surface of the liver. Certain mutations of the PCSK9 gene can lower the number of LDL receptors. This can cause an inherited form of high cholesterol, known as hypercholesterolemia. High LDL cholesterol may lead to cardiovascular disease, heart attack, or stroke. Other mutations of the PCSK9 gene can actually lower LDL cholesterol by increasing the number of LDL receptors. So, people with lower LDL cholesterol levels have a lower risk of developing heart disease and stroke. Types of PCSK9 drugs and how they work. PCSK9 drugs suppress the PCSK9 enzyme expressed by the gene. That's why they're called PCSK9 inhibitors. In August 2015, the Food and Drug Administration, FDA, approved evolocumab, Repatha, a PCSK9 inhibitor from Amgen. In clinical trials, evolocumab was used for 1 year. They had about 60% lower LDL cholesterol than the control group. 1 year later, slightly over 2% of those in the standard therapy group had a major heart-related event compared to just under 1% of those taking evolocumab. In July 2015, the FDA approved alirocumab, Praluent. A recent clinical trial had similar success in lowering LDL cholesterol. Only 1.7% of patients experienced some type of heart-related event during the 78-week trial. Side effects and risks of PCSK9 drugs. All medications have the potential for side effects. Adverse events were reported in 69% of people taking evolocumab in the clinical trials. Meanwhile, swelling or rash at the injection site, limb soreness and fatigue are some of the side effects reported. Also, less than 1% reported mental confusion, difficulty focusing, or other neurocognitive issues. In the alirocumab trials, adverse events were reported in 81% of participants taking the drug. These included injection site reactions, muscle pain, and eye-related events. Slightly more than 1% of participants reported neurocognitive adverse events. These included memory impairment and confusion. Long-term side effects and risks are not yet known. PCSK9 drugs and statins. Both PCSK9 inhibitors and statins have been shown to be effective in lowering LDL cholesterol. Statins work by blocking HMG-CoA reductase. That's an enzyme your liver uses to make cholesterol. Moreover, statins also help your body reabsorb built-up cholesterol deposits from your arteries. Most people can take statins without difficulty. However, some people can't tolerate side effects like digestive problems and muscle pain. Statins have been around for a long time, so your doctor can give you information about how they work in the long term. They're available in brand name and generic tablets and have become quite affordable. PCSK9 inhibitors may provide another treatment option for people who have high LDL cholesterol. Greater than and at high risk of cardiovascular disease, statin intolerance. These newer drugs require injections every 2 to 4 weeks. We don't yet have enough information to know how PCSK9 inhibitors will reduce cardiovascular events over time. How does this affect treatment for high cholesterol? According to the U.S. Centers for Disease Control and Prevention, 73.5 million adults in the United States have high LDL cholesterol. Statins are currently the first-line therapy for those who can't control their cholesterol through diet and exercise. Meanwhile, the PCSK9 inhibitor has become a viable alternative treatment for those unable to take statins. Note: understand the causes and prevention of the disease so that you can promptly treat the signs and symptoms of the disease. The purpose is to solve your problem. So be open and ready to experiment. At the same time, choose your strategy, take action and start enjoying the benefits. Reference: The One Food Cholesterol Cure, 2 months free solution. Or visit 247naturalhealth.com to all chronic illness information. Link in the description. In particular, if you know Qigong and its miraculous improvements to health, visit falandafa.org. Thank you. I hope you are always happy and healthy. Thanks for watching. Don't forget to subscribe to the channel to receive useful information.